Hi, Professor Amin bin Ismail again from Department of Nutrition and Dietetics. Today we will learn about polyphenol, metabolism, bioavailability, and health benefit of polyphenol. What are learning outcome of this topic? At the end of this topic, you should be able to explain the metabolism and bioavailability of polyphenol. Then you able to discuss the health promoting properties of polyphenol. Metabolism of polyphenol. Most flavonoids in our diet are in the form of glycoside. They are deglycosylated by enzyme in our small intestine before absorbed to our bloodstream. After absorption, they are metabolized by the phase 2 enzyme to gluconate and sulfonate conjugate. Flavonoids that are not absorbed in our small intestine can be metabolized by the colonic bacteria microflora to aglycone and phenolic acid. These are the diagram of the metabolism of the polyphenol in our body, our human body. That is, polyphenol will go to the small intestine, and then some of them will absorb into the liver, and then due to the process, they will go to the other tissues in our body, like the kidney, and then some will be excreted out through the urine. Some of the polyphenol will go to the colon and then go out to the feces. These are bioavailability study of polyphenol. Not all polyphenol are absorbed with equal efficacy. Only aglycone and some glycoside can be absorbed in the small intestine, or other polyphenol are not. Maximum absorption of quercetin for glycoside occur 0.5 and 0.7 hours and 6 to 9 hours for quercetin 3 rutinoside after ingestion of the same quantity. Absorption of quercetin is more rapid and efficient after ingestion of onion than apple. Procyanidin are very poor absorbed in our small intestine. Health promoting properties of polyphenol. Flavonoids are the most polyphenol compound have much interest because of their powerful antioxidant activity in vitro model, being able to scavenging a wide range of free radical. However, the biological activities of flavonoid have been evaluated in vitro model using aglycone or glycoside that are present in food. Very little is known about the biological activities of the conjugated form present in plasma or tissue due to the lack of precision of identification and commercial standard. Cocoa and its polyphenol. What the benefit of the cocoa? As to reduce the CVD risk factor, to increase the insulin sensitivity, to reduce our blood pressure, to increase antioxidant defense, and also to decrease the cancer risk. Flavonoid and cardio heart disease. There are studies in Zupan study suggested an inverse correlation between the incidence of coronary heart disease and stroke and the flavonoid, quercetin. And then another study, Suvimac study, indicated that women with high consumption of flavonoid-rich food may prevent cardiovascular disease. However, several other epidemiological studies have confirmed similar association. However, a few are not. A meta-analysis of prospect cohort study published by before 2001 indicated that high dietary intake of flavonoid may associated with a reduced risk of CHD mortality in free living population. There is a little evidence that flavonoid protect against cancer. Several studies reported the protection of flavonoid against neurodegenerative disease. However, it is unclear. A meta-analysis of randomized control trial to determine changes in blood pressure due to the intake of cocoa product, indicating that consumption of cocoa-rich food may reduce blood pressure. A meta-analysis study on polyphenol and tea, they found no significant reduction of myocardial infarction incident with an increase in tea consumption of 3 cups per day. Another study on polyphenol and women health. A study suggested that dietary isoflavone have a small protective effect on the risk of breast cancer but not lignin. A meta-analysis suggests that isoflavone supplementation may produce a slight to modest reduction the number of daily flushes in menopausal women. Another study on polyphenol and women health, they found that preventive effect of isoflavone on bone loss and fat accumulation in elderly postmenopausal women. And then another future study on health benefit of cocoa based on the clinical trial or omic analysis. Thank you. Bye-bye. See you next time.